Alrighty, so we have this terrific gentleman who is here today, and we're going to start an otoplasty procedure very soon. We're going to do this in the office. Otoplasty can be done in the operating room, but it can also be done in the office successfully in both locations. We were just having a chat, and I was actually just talking to one of your family members as well, who has a little bit of this going on as well in terms of the ears that protrude. So tell us in your own words, when did you start thinking about, maybe, geez, I want to do something about my ears?
Well, probably sometime around my 20s is when I started to consider it, and at that time it was very early phase maybe, and then I learned more about it being, I guess what I would describe as a relatively accessible procedure, fairly low risk, and I was like, oh, it'd be great to maybe do that someday, but then, work, money, all these things, and then also questions of should I do it, should I not, but over time, I kind of settled on the fact that I did want to do it, and everything else lined up pretty well, and that was really just more about who, where, and that's when I started looking.
And then, how'd you come to find us and decide to move forward?
I kind of assumed that I would need to go to a large city, like the East Coast, West Coast,
Uh-huh.
and then I found your practice probably a year or two ago, and I was kind of watching your site, looking at it, and I noticed you were developing. And that's how I ended up here.
There it is. Everybody walks a very personal path. You could have decided a few years ago, do I love it? No, but it's not worth going through it. We always tell our patients, nobody needs any of this. My practice is focused around cosmetic facial plastic surgery. The reality is people don't need these procedures. They want these procedures. But we always tell patients we're not trying to diminish that motivation, right? If this is something that you're not loving, that bothers you a little bit, we think it's an entirely legitimate thing to sort of say, okay, there's a pretty safe and dependable way to go about changing it.
Right.
So fantastic. So we're going to, you can see on this side, there's a little bit of protrusion on the ear, but this side there's a little bit more. So we have to gauge this carefully and try to bring the ears a little closer to the head, and to do it as naturally appearing as possible, and to try to make it as symmetric as possible. So thanks for your attention, and we'll give you some updates going forward.